Morning, good evening from Miami. This is Dr. John Bennett for Neurosurgical TV. We are televising the conference, a neurosurgical conference for the Yemen Society of Neurosurgeons. Again, today's the second day, and today we have Victor Hugo Perez Perez, MD, a famed neurosurgeon, neuroanatomist from Mexico City. And Victor's going to talk today about the anatomy of the spinal cord. And also we have a few guests. Hello, Marco. Say hello quickly.
Hi, good morning. I'm from Bolivia.
Okay, welcome, Marco. Welcome, Marco. Okay, Victor, it's all yours.
Okay. Let's go to talk about the surgical anatomy, vascular anatomy of the spinal cord. As you know, Albert Adamkiewicz was the first to inject some veins and arteries of the spinal cord. What he did, he injected arteries and veins of the spinal cord, applying a special method using Teichmann mass, which consisted of ammonia, zinc white, linseed oil, mercury sulfate, or carmine sediment for the red color of the arteries, and Prussian blue for the veins. It was about 150 years ago. So he discovered the great radicular spinal artery, known as Adamkiewicz artery. This is a draw that he did after his injections. In this drawing, you can see the vertebral arteries and the anterior spinal artery. Now we are doing the same, but with a special injection, silicone injection in red color for arteries and blue for veins. Nowadays, we can get some beautiful photographs about this. In this case, you can see the vertebral arteries. One of them is hypoplastic, the right vertebral artery hypoplastic, and the left is giving rise to the basilar artery. The artery of Adamkiewicz traveled with the ventral root to the ventral surface of the spinal cord, where it took a characteristic hairpin turn caudally. This is a picture about this Adamkiewicz artery. This is the principal artery that is giving rise to the vascularization of the lumbosacral segment of the spinal cord. The irrigation of the spinal cord is heavily dependent on the artery of Adamkiewicz and branches of the vertebral arteries. This artery is of enormous clinical, surgical, and radiological importance. Here we have the posterior aspect of the cerebellum and upper cervical spine, and the first dorsal roots of radicular nerves. Here we have a picture of the Adamkiewicz artery. In the superior photograph, we are seeing a very small thoracic artery. Look at the difference in the size between the thoracic artery and the Adamkiewicz artery. The preoperative localization of this artery is very important in the surgical transthoracic spine procedures. The anatomical knowledge gained preoperatively may reduce the risk of postoperative paraplegia. I have studied almost 50 spinal cords. What I am showing you is the statistics of this work. In these pictures, we are seeing the highest level of the origin of Adamkiewicz artery. This Adamkiewicz artery is arising from T3. You can go through all the nerves, beginning to the upper segment, C1, C2, C3, C4, C5, C6, C7, and then T1, T2, T3. And this is the highest level of this Adamkiewicz artery in my work, in my research in these arteries. In the lower picture, you can see some the origin. This is really beautiful. This artery is the highest level. So the lowest level, as you can see in this picture, is arising from left L2. This artery was the lowest. Left L2, the lumbar 2 radicular nerve. This is a lateral view of this artery. We are displacing the nerve roots, and you can see in this picture the posterior spinal artery. Drawing obtained from an original article by Adamkiewicz, published in 1881-1882, showing arterial vasculature of the spinal cord and the bidirectional flow of blood in spinal cord vasculature. This was a drawing. Now we can see really beautiful pictures about this vascularization. Here we have some veins and some radicular arteries, and in the posterior aspect of this spinal cord, we can see the posterior spinal artery. All the 40 spinal cords had Adamkiewicz artery. It was very common, this artery. 36 great anterior radiculomedular artery from the left side. 11 from left T9, and 8 from left T8. In this study, the average diameter of the artery of Adamkiewicz at the spinal cord was 0.81 millimeters, range from 0.6 to 1.11 millimeters. In 4 spinal cords, the great anterior radiculomedullary artery, Adamkiewicz artery, was in the right side. But 2 of these spinal cords, the Adamkiewicz artery was double, as you can see in this picture. One arising from left side and the other one from right side. Okay. This is an Adamkiewicz accessory artery. This is arising from lumbar nerves and Adamkiewicz artery, giving rise to a small thoracic artery and the Adamkiewicz artery. Okay, this is the thoracic artery was present in 38 spinal cords. 32 in the left side and 6 in the right side. 2 spinal cords did not have thoracic artery, most frequent in left T4, 9 specimens, followed by left T3 in 7 specimens. In 10 spinal cords, there were a double thoracic artery. The thoracic artery in the left photograph, in the left picture, the thoracic artery arises from right side. The thoracic artery is arising from left side in the right picture. The thoracic artery is the small caliber. A small thoracic artery. The narrowing of the thoracic segment of the anterior spinal artery has an average diameter of 0.33 millimeters, 0.17 millimeter to 0.53 millimeter. This measure was done at thoracic 5 level. This is a thoracic artery. The Adamkiewicz artery, no, this is not the Adamkiewicz artery. This is another artery that is very constant, the great posterior radiculomedullary artery. This posterior radiculomedullary artery was found in 28 spinal cords. This artery was found in the left side in 19 spinal cords. In 16 spinal cords was found in right side. In 7 spinal cords was found in both sides. This is a really beautiful artery. This posterior radiculomedullary artery is the opposite to the anterior great anterior radiculomedullary artery, Adamkiewicz artery. The posterior artery is coming from left T10. Various authors postulate such a vessel. Gillian in 1958, Lasortz in 1957, Romans in 1965, Jellinger in 1966. Others do not mention it or even deny its existence. Corbin, 1961, Clemens, 1966, and Domis in 1980. These authors deny the existence of this great posterior radiculomedullary artery. According to Jellinger, a large posterior radicular artery is in caudally in about 75% of instances, but its caliber does not approach that of the large anterior vessels. Diameter 350 and 500 micras. Its side is more caudal than that of the anterior radicularis magna artery. There is no doubt about its existence, and it's very important to know this artery. This is this picture. In this picture, we can see the great posterior radiculomedullary artery. In this case, is coming from left T9. This is the posterolateral aspect. In this spinal cord, even when there is not a great posterior radiculomedullary artery, there is a very good anastomotic arch, Adamkiewicz, and the posterior spinal artery. Look at the conus medullaris. This is the conus medullaris, and the anastomotic arch is very nice. A right view of the anastomotic arch. The nerve roots have been displaced to the left side, and we can see the lateral aspect of this beautiful arch, anastomotic arch of the Adamkiewicz artery, giving rise to the posterior spinal artery. In this spinal cord, there was not a great posterior radiculomedullary artery. Instead, there were several radicular arteries giving rise to a posterior spinal artery. Left view of the anastomotic arch. Most of the arterial supply comes from the right side of the anastomotic arch. In this photograph, you are seeing the posterior aspect of the lumbosacral segment of a human spinal cord. You can see also a great posterior vein over the surface of the posterior aspect. Cervical radiculomedullary arteries. There were 24 cervical arteries.
इंटरनेशनल एक मीटिंग चल रहा है
Excuse me?
यमन में कॉन्फ्रेंस डायरेक्ट टेलीकास्ट होगा यमन से
Is there some problem, John Bennett?
Excuse me, Dr. Gupta, could you please mute yourself? Okay, I'm sorry. Go ahead, Victor.
Go ahead.
Okay, go ahead.
Okay. There were 24 cervical arteries coming from the right side, 8 from C6 and 8 from C7. There were 11 cervical arteries coming from the left side, 4 from C5 and 3 from C7. In 4 cord spine, there were 4 cervical arteries. In 5 cord spines, there were 3 cervical arteries. And in 8 cord spines, there were 2 cervical arteries. They are also really, really beautiful. These arteries are very important because in surgery of the resection of a disc, we should know where this artery is more common. The average diameter is 0.49 millimeters from 0.21 to 0.73 millimeters. Cervical artery. This is the smallest. This artery was the smallest. In 29 spinal cords, there were a great spinal anterior vein. We are told about the anterior vein. Average diameter 0.8 millimeters from 0.46 to 1.32. Look these pictures. It's really beautiful. The vein. We can see a great anterior vein. Beautiful, beautiful this picture. The vein and also the artery. These are the posterior veins. In 32 spinal cords, there were a great spinal posterior vein. Average diameter 0.86 millimeters from 0.52 to 1.48 millimeters. Look at this. This is the biggest, 1.48 millimeters, almost 1.5 millimeter. This is also a beautiful photograph about the veins of the spinal cord. Look at this. This is impressive. This is amazing. How the veins form like a weird. Covered by the arachnoid. only few spinal cords have this aspect. This is another shape of the vein. The smallest was this, 0.58 millimeters. Vein with some small curves. These are several shapes of these veins. So this is a vein that is crossing a nerve, a radicular nerve. As you can see in the upper part, the vein is between the fibers of this nerve. These are some interesting fissures in the veins. In the upper photograph, we can see the cervical posterior aspect. John Bennett, I want to show the video. Do I have some time?
Okay, we're going to wrap it up, Victor, in a few minutes, okay?
Okay, how many minutes do I have?
2 or 3 minutes.
2 or 3 minutes. Okay, let's go to show more photographs about the lateral aspect of this human spinal cord. Adamkiewicz also attempted to describe the venous network, which was subsequently characterized as complex and difficult to interpret. He also noted the variable density of microvasculature within the spinal cord. Now we are working, I am working, I am trying to describe more precisely the network of the veins of the human spinal cord. It's very, very interesting. So this is the last picture. I like to ask you if you have some questions about this. What I do to inject these spinal human cords is to get a fresh spinal cord and to inject with silicone the very, very small vessels to get this kind of injection. This is the last picture, John Bennett.
Okay.
Do you have some questions?
Yeah, let me ask Ismail. Ismail, do you have any questions from the audience that they would like to ask of Victor? Any questions?
John, I have a small question myself.
Sure.
Okay, the lecture is very difficult actually. So, what is the main arterial supply for the spine? I mean, if we are going to make a surgery, what is the most important precautions regarding the intervention and avoiding of ischemic injuries?
Okay, I think that the most important feature in the spinal cord is to know if there is a good Adamkiewicz artery and also a posterior spinal artery. For example, if the vascular surgeon is going to clip an aneurysm of the thoracic aorta, if he has some accident with the Adamkiewicz artery, but this person has a good anastomotic arc in the conus medullaris with a very good spinal posterior artery, we are not going to have a ischemic process in this patient. So for that reason, it's very important to know if we have the anterior and the posterior radiculomedullary arteries.
Okay,
Very
second
good.
question.
Very good.
John, the second and last question. What is the best tool to diagnose the blood supply for the spinal cord? I mean, should we perform a routine CT angio, MR angio, or a conventional angiography before any surgical procedure?
Well, these arteries are very difficult to interpret in neuroradiological studies. It's not easy to find these arteries because it's very, very small. The posterior radicular artery is about 1.500 micras, half of a millimeter. So it's very difficult to see that in a radiological interventional studies.
Very good. Okay, Victor, thank you very much for an excellent presentation.